In this video, we are going to talk about calcium oxalate dihydrate crystals. Basically, these are the crystals that form in acidic urine. They are unlikely to dissolve medically. You should remember that medical dissolution of all urinic crystals is possible, but it is very difficult for calcium oxalate crystals. Calcium oxalate crystals form in standing urine that is found in stored samples, like you have fresh urine sample that came in your lab today. You check the sample and you found no calcium oxalate dihydrate crystals, but after you store that sample in your refrigerator, and then 2 days later or 1 day later you recheck that sample and you're going to see calcium oxalate dihydrate crystals. So it is always found in the stored or standing urine samples. As far as its shape is concerned, these are small crystals that are square with cross striations resembling an envelope. And these squares have a perfect X in the middle. You can see in these images. These are normally found in miniature schnauzers despite no abnormalities found in their urinary calcium excretion. Other breeds that are predisposed, you should remember these two, that Lhasa, Poso, Yorkshire, Beacon, Shih Tzu, miniature poodle. These all are breeds that are predisposed to the one of the indication for calcium oxalate dihydrate crystals in urine is hypercalciuria, that there is increased calcium excretion in the urine due to any of the disorder of the calcium metabolism. For example, in hyperparathyroidism, we have increased calcium excretion in the urine, and that calcium in the urine binds to the oxalate that is present in the urine and forms the calcium oxalate crystals. Again, medical resolution is possible for most stones except calcium oxalate. So we cannot dissolve these stones, but we can prevent these stones. And for prevention, we can have dietary managements like feed low protein, low calcium, low oxalate, low vitamin D, low sodium. Why vitamin D? Because it is related to, it has a relation with the calcium metabolism in the body. Provide adequate phosphorus. Why adequate phosphorus? Because phosphorus is less, again it will like activate vitamin D, and vitamin D will also affect the calcium metabolism and increase that calcium in the urine. Provide adequate for magnesium, vitamin B6, because again they have synergistic effect, or they have like effects related to each, like iron to iron, or calcium, magnesium, these have their proper ratios. If they are disturbed, the metabolism of your body will affect the other two. Then change the urine pH, because we have seen in the previous slide that they are mainly formed in the acidic urine. So you can change the urine pH from acidic to basic, and for that you can feed the potassium citrate to the animal to get the desired urine pH, and in this way you can prevent the calcium oxalate crystals. So this was all about calcium oxalate dihydrate. In the next video we will talk about calcium oxalate monohydrate crystals. So stay tuned in, and guys, content making takes lot of effort, so do like, subscribe and share these videos. Thank you so much.